Another question we've had is, do the COVID-19 vaccines affect my periods? Now, although there's been no proven link between the COVID-19 vaccines and menstrual disorders, there have been some reports from some women reporting changes to their periods after getting their first or second dose. That could be a slightly heavier bleed, a delayed period, some spotting between their cycles. There's been loads of reasons why this could occur. For example, we know that the womb lining does have some immune cells, so once we trigger it with the vaccine, it could be that it's triggered slightly early to release its lining or to spot slightly. But there's no proven link really between having a long-term menstrual disorder and the vaccines themselves. Other vaccines have had similar effect on periods, but no long-term effects on fertility as well. So you can still get vaccinated even if you are worried about your periods. Can I shed the vaccine to my sexual partners? And the answer to that is no. There's no real live virus component within the vaccine, so there's nothing in the vaccine to make you infectious or contagious to other people at all. However, if you do test positive for coronavirus, then do remember to self-isolate and stay away from people, and that includes people that you're having sex with as well, because you'll be in quite close contact with them and you'll be a risk to them in that case. Will the COVID-19 vaccines affect my contraception? If you are on the pill or the patch, the Faculty of Sexual and Reproductive Health still recommends that you get vaccinated, regardless of the type of contraception that you're on, which is really important for those of us who are worried about side effects such as clots. It's important to know that even though there is a clot risk with your combined hormonal contraceptives, so the combined pill, the patch, for example, that risk of clots is lower than the risk of clots in pregnancy, so if you did fall pregnant. And that risk of clots is not linked to the clot risk that we've seen previously with AstraZeneca, which had a different mechanism of action that was related to the immune system rather than the clot risk that's associated with the combined pills. So if you are worried about your contraception being affected, don't be. You can still get vaccinated while you're on contraception. It is worth noting, though, that you might potentially see some of those changes in your periods that we've talked about, although there's no proven link between that, but it's just important to let people know.